if you go and poke around, I might have put this PowerPoint in test 1. I might have put it in test 2. Find it. It's the first portion of it is the heart, and then the second portion, the larger portion of it, is the vessels and such. But we're going to get this first little part. There's some things I want to cover and all in it. Some of these you can read and all, and you'll see about the stroke volume and such, and how you can calculate how much the blood flows in a minute of time and all. So, and then the things that affect the stroke volume right there, the preload, the stretch and such is the preload right there, and the things that affect the preload and all. And you see it's two big ones, the Frank Sterling law right there. The heart ventricles pump harder when you need more blood, when the cardiac output is needed. And then there's also this equalization output. The right and the left pump the same amount. They just pump them to different areas and such. The preload is proportional to the amount of blood left, the EDV left in there and such. So a resting heart fills more. An active heart fills less. That's pretty much the preload. Other things that affect this contractility, or this regulation here, is the contractility of the myocardium, and that's affected by certain things. They're known as inotropic agents, and you have some that increase the contractility, positives, and you have those that decrease, negatives. So positive inotropic agents, those that which will increase the contractility and such, of course, is calcium, epinephrine, sympathetic stimulation and such, being excited, being scared, fight or flight, and then just the adding epinephrine. Things that slow it down. Well, anything that inhibits the sympathetic nervous system, no oxygen, low pH, anesthetics, things they give you when they knock you out and such, too much blood potassium, and then a type of medication known as a calcium channel blocker. It's a blood pressure medication, those are. Think about this. What's the reason of your blood pressure? Your heart's beating. You want to lower pressure? Slow the heart down. That's one way to do that. Don't let calcium get to the heart. Calcium increases things, so take out the calcium. Don't let yourself get to that point. And then afterload, that's the pressure that's in the pulmonary trunk and in the aorta. That's the blood pressure that the heart must overcome to eject blood to the rest of the body, to the lungs and to the rest of the body and such there. When your blood pressure goes up, that increases. The heart has to work harder. Now, why is it going up? Usually because your blood vessels, your arteries have become more narrow, tightened down, constricted. So you want to do things which relax your arteries, which cause them to not have as much pressure in them. So then the heart doesn't have to work as hard. So, all right. So you have your heart and it runs on automatic, like I told you. There's an area in your medulla. It's a cardiovascular center and such. It's getting all of this input from your brain, from the front of your brain, from your amygdala, from other parts. The old clock going off there. So from your emotional center, your limbic system and such, you can cause your heart to speed up and such, just by thinking about something, by getting excited, thinking about riding a roller coaster or whatever. From where are your muscles located? What's the angle of the joints? Are your arms above your head, below your head? How things are arranged right there. What's the chemical nature of your blood? High CO2, low CO2. And then what's your overall blood pressure? All of this information comes in, and the medulla then says we need to speed up or we need to slow down. So if you need to speed up, it'll send information down through the sympathetic fibers. The sympathetic fibers then go to that SA node, the AV node and such, and they say, hey, depolarize quicker. If you need to slow down, it'll send a signal down through cranial nerve 10. That's the old vagus nerve. and it'll go to that SA node and say, hey, slow down. Don't depolarize as fast. It may even cause a release of acetylcholine. Acetylcholine slows the rate of that SA node depolarization. Remember, acetylcholine is a neurotransmitter that's also found in your skeletal muscles, which actually enhances or triggers the contraction there. In the heart, it slows the heart down. You leave the heart alone, cut your head off, take your brain away, the heart's going to beat about 100 times a minute. When the brain is active, it slows everything down to about 75 beats per minute and such. So you can get a thump, just like if you were to hit your funny bone, you can get a vagal stimulation, a maximum vagal stimulation and such, and you can actually cause the heart to stop. A sudden impact to the chest, an impact to the neck can cause that. So chemically, you can use hormones to increase the contraction rate. Epinephrine does that, norepinephrine does that. They're cut from the same cloth, those two are. And then your thyroid hormones, your T3, your T4 and such, thyroxine, that does that. Calcium causes it to increase. Those things that decrease it, too much sodium or too much potassium. Increase, too much calcium or excess calcium and such. And then, of course, your CO2, O2, which is also measured and shows in your pH of your blood, has the same positive and negative benefits and all. Other things, how old are you? How young are you? Fetuses in womb have 120 up, it seems to be. And then at birth, it's about 120. Then it slows down. Females have a little bit higher rate than males. Your physical conditioning, if when you were young and then fit and your resting heart rate was 65 and now you're old and fat and your resting heart rate might be 85. Age and physical conditioning. Your body temperature. Cool you off, slow it down, speed you up, warm you up, speed it up. So body temperature has a lot to do with it. Heart disease is one of the #1 leading causes of death. 1 in 5, that's 20%, such. What are the risk factors of heart disease? You see it, cholesterol, lack of exercise, high blood pressure, diabetes, type 2 diabetes and such, smoking, being obese, being a male, and then it could just be genetic. You might have a genetic predisposition to having heart disease. Some of the things you have control over, you can control and fix your diet. You can change your habits, and such. Diet is where you're going to get cholesterol. You get cholesterol from animal products. Your liver makes cholesterol. If everything's done right and you're living right, your liver will make the cholesterol and it will actually help remove any plaquing or fatty deposits. It'll make a right and good type of cholesterol. Your diet can affect that. So too much cholesterol can cause the lumen, that's the middle part of the vessel, to decrease and such. And that can affect the speed of the blood. It can affect other things. It can cause a clotting, a thrombus to form. And that can break loose, travel through the heart to the coronary artery, get to one of those deeper in the heart muscle, and boom, myocardial infarction. There's different types of cholesterol, like I mentioned to you. There's the LDL and HDL. You want the HDL. Your total cholesterol will be a collection of both of them. And you need both of them. You need cholesterol. Cholesterol is needed to help stiffen up your cell membranes. Your liver makes it. You have to have cholesterol and such. Cholesterol is the basis of many of your steroid hormone production. You have to have cholesterol. So our diets in modern America, we get too much. Your triglycerides are what's known as a VLDL, a very low density lipoprotein, and also. And usually when you're moving fat around from the liver to your adipose, from your adipose back and around and such, that's your VLDLs and such. But cholesterol only comes from animals, animal products. And so you can see that right there. So am I telling you to become a vegetarian or a vegan? No. Am I telling you to try to eat a healthy diet, a sensible, healthy diet? Yes. You can look at what your levels should be And these levels change all the time. So, but for our class, we want a good total below 200. You can see the breakdown of the HDL and LDL and such. If you'll take your total and divide it by your HDL, you'll get a value, a ratio. And so you kind of want that ratio to be 3 or less right there. So really 4, below 4 is good. But if you have something higher than that, then that's not good. So you can see the things that it does for you right there. How you can actually improve it, improve diet, weight loss, and exercise. Tell you all the time, no one pays attention. It's just that simple. It's you changing your habits. You know, there are medications for it. If you want to be tied to a pill, if you want to be paying that money all the time, go ahead. So, diet and exercise. That's the key right there. So, having your cholesterol in the right ranges, having a good healthy amount, you can see all of the positives that it does for you. Having too much LDLs, having high cholesterol, just take those and make them negatives, and that's what you get. Okay. Other disorders of the heart, other cardiac ones right there, angina pectoris, that's just chest pain. That can be due to the heart not getting enough blood flow, not getting enough oxygen. If you're doing something and your heart starts to hurt and you stop and the pain goes away, you kind of know what you have. A heart attack, usually it's due to restricted blood flow from a thrombus or an embolus. That is a myocardial infarction, and you will kill the heart muscle and it will replace itself through that stromal repair, and you'll get scar tissue. Scar tissue does not contract. Heart is not as an effective pump. You can see the other problems there, the heart murmurs that you would hear, stenosis or an insufficiency, or you can have an aortic stenosis and such. You can have prolapse as well. Those other things. That's not an exhaustive list. Congestive heart failure, the heart just quits. Gets tired of you and it just quits. It could be congenital. It could be due to blood pressure, long-term high blood pressure. It could be a valve problem. It could be a clot. Basically, you just don't pump enough. And if you're not moving the blood around, because since the blood is not flowing appropriately through the capillary beds, excess fluid accumulates in those tissues. That's the edema. That's the swelling. And if you'll notice where the fluid accumulates, that points to what side of the heart is weakening. So if your left ventricle, the part that pumps it to your body, is becoming weak or damaged due to the mitral valve, if you name it like that, or some other, then you're going to have fluid in the lungs, pneumonia. If the right side is wearing out because of excessive high blood pressure, then the fluid is going to accumulate usually in your lower extremities, in your lower legs and such. You get the fluid build up in your ankles and all. So, any abnormal heart rhythm is an arrhythmia, and it could be due to a problem with the SA node, AV node, Purkinje bundle of his, somewhere around in there. Some things that you ingest can affect that: your nicotine, your caffeine, your alcohol. Having a thyroid that's out of whack, not having enough potassium in your diet. So you have to have all of those. You can change any of that, and you can have a serious effect on your heart. Other problems there, you can read about those: atrial fibrillation, ventricular fibrillation, and such. You can live without the atria, really. You can make do with that, but when the ventricles quit on you, death. So you can't live without that. How do you fix it? You shock it. That's how you fix that rascal. So take care of your heart. It's the only one that you got.